A birth defect is simply defined something visibly wrong with the structure of the body of a newborn. In context, it means that there is a structural problem that happens before, during, or shortly after birth of a baby. This can be due to something occurring in the process of formation of the baby, and this arises from either genetic abnormalities, exposure of a baby before they are born. It could be exposure from medication, some of the medications the mother is using, or environmental exposures, poisons, herbicides, or pesticides. And finally, you can get defects, birth defects, as a result of whatever happens in the course of pregnancy, what we call deformations. This means that a baby was initially well formed, but something happened in the course of pregnancy. Either the mother had, for instance, tumors or swellings in the uterus that made the baby not quite positioned properly, and so they ended up with a part of the body not formed properly, or there was reduced fluid around the baby, or so those can also lead to birth defect. The commonest is what we call musculoskeletal, which means it involves the limbs, especially. It could be one arm, both arms, or both legs. Those are the commonest. But we also have defects that can occur in other body systems, and commonly we have defects affecting the heart, affecting the brain, and generally the form of the skull. And we also have what we call gastrointestinal defect. So most serious is defined by how much it affects the function of the baby's body. You can have mild defects in any of the systems, but you can also have quite serious defects. So the vital systems that would lead to serious defects are: one, the brain. If the brain is not properly formed and there are core areas that are not developed, then it becomes incompatible with life. Like in the most severe case, we have what you call an encephaly, where the brain is just not there, and this baby cannot survive outside of the uterus. We also have heart defects, which we know how vital heart function is, and if there are significant defects, then the baby cannot survive. And many of the other internal organs. So that is what defines the severity of a birth defect. Many of these musculoskeletal defects tend to be compatible with life because those affect a baby as they grow rather than immediately they are born, and many of them are amenable to correction. You can have genetic causes where the problem is in the genes, the building blocks, and this can arise from several factors. One is what we call mutations. These are just random accidents in the genetic, formation of a baby. You can also have some genetic defects that run in families, so they tend to recur, and if one baby is involved, one baby is affected, then the next one is even more likely to be affected. And you can also have environmental exposures, chemicals and poisons that the mother is exposed to, especially during pregnancy, or lack of some elements. For instance, lack of folic acid has been shown to be associated with neural tube defects, that is disorders of the spine and the spinal cord and the brain. And then you have what I refer to as deformations, where you have the pregnancy, in the course of the pregnancy, then a baby who was previously well formed can start having deformities, like they are not quite in the right position in the uterus, so you find the feet or the legs are bent, or the arm is twisted in a position that's not right. The world is moving, and we are moving towards early diagnosis, because we know that early diagnosis leads to better outcomes. Early diagnosis needs to be during pregnancy as far as is possible, and this is primarily achieved by antenatal ultrasounds. that are done on the mother while pregnant. Most of these defects can be picked up in the early second trimester and in the third trimester. There are actually interventions in place for some of these defects, especially if it's believed that they may affect survival of the baby after birth. So surveillance and just follow-up using antenatal ultrasounds goes a long way in detecting many of these defects. Some birth defects can be prevented, while some may not be possible to prevent. Those that arise from exposures can be prevented by just teaching women to recognize that they are pregnant early on, and so avoiding possible exposure to medications and to chemicals that can lead to birth defects. Another way of preventing is the use of folic acid, which has been shown to go a long way in reducing the occurrence of neural tube defects, problems with the brain and the spine. And we are encouraging, and it's a program currently in the country, that all women of reproductive age, we encourage that they plan for pregnancy rather than just conceiving spontaneously, and taking folic acid supplements, hopefully 6 months before conception. If this is not possible, then at the beginning of pregnancy, then they need to be started on folic acid supplementation through to the second trimester. And this has been shown to significantly reduce the number of birth defects related to the brain and the spine. Then attending antenatal clinic, so that some of these risks are picked up. For instance, if a mother is having reduced amniotic fluid in pregnancy, then the obstetricians can manage that and reduce the chances that this baby will be born with deformities, both in the lungs and in the limbs, and yeah. Challenges faced in managing these babies range all the way from parental and societal expectations. We live in a society that expects perfect babies at birth, and so the first question, and probably the most difficult question that we are faced with, is when a baby is born and they have visible structural defects, acceptance. And we have actually had some parents who outright reject some of these babies, or are not very willing to support their care. The other challenge comes in delayed recognition and therefore delayed intervention. We would like that babies who have birth defects are recognized before they are born, so that if a referral is needed, they are referred before birth, so that they are delivered in a setup where that condition can be managed with as little effect on the baby's survival ability as possible. So we do get babies who have already been born and referred to us, and because of the challenges of referral systems, we find that they present fairly late. Sometimes that has an impact on how easy to correct the defects are, and it has a bearing on their survival. Genetics is playing an increasingly important role in managing many conditions in our newborns. Genes are the building blocks of the body, and if anything goes wrong at that point, then it's bound to have a big impact on the development of this baby, both before delivery and after birth. And genetics plays a role in a few ways. One is we have inherited conditions that tend to recur. So recognizing that this parent or both parents are carrying probably traits or some genetic material that has a potential to impact on the wellness of a baby is important, because that helps us to anticipate having a baby who has defects and managing it early, because we said one of the things that impact on survival is how early or how late we intervene. In some cases, genetic counseling may avert some of these deliveries, because then the parents know that, there's a good chance, or there's probably no chance that they will have a genetically normal baby. In pregnancy, there are evaluations that can be done to identify parents who are at risk of getting babies with genetic defects. And these are available in the country in collaboration with some institutions. So that is an important aspect to consider. The role of genetics also plays a part in babies who are born to mothers with an increasing age. And we know that the society is moving towards having older mothers. So no, we don't discourage them from getting babies, but we encourage that they are assessed by qualified staff who we have, to know if there's any chance that they might be at risk of getting babies who have defects, and know how to manage those accordingly. So birth defects can cut across any system of the body, and the effect is not usually limited to one part or one system function, and that calls for a multidisciplinary approach in managing them, recognizing, managing, or controlling, because sometimes they are not treatable, but they are manageable. So we have a team of competent staff in the different areas, and that calls for collaboration between the doctors, and the doctors in this case are the neonatologist, the surgeons, the cardiologist, if that's necessary, the neurologist. We also have rehabilitation, so occupational therapists, physiotherapists, because these are important in restoring function where it is not initially optimal. Nutritional support, so we need nutritionists on board. We need counselors, because I mentioned about stigma and the expectation that parents have. So they need to be supported in this journey in managing defects. And of course, we have our nursing team who play a critical role in helping stabilize these babies and getting them on the path to recovery even before they can go home. So the first resource is ourselves, just educating them on what it means to have a baby who has a birth defect, what it means in terms of the quality of life, what it means in terms of what we expect of them as parents. We have counselors who help them walk this journey, because it's not easy for any parent to get, we all expect a bouncing baby, girl, boy, and sometimes that's not optimal. So helping them in the acceptance journey and helping to understand what they are going through. We have other areas of help and support. So there are some support groups for some specific conditions that have been shown to be common, and there are parents who come together and support one another, and just there's nothing as powerful as knowing somebody has walked this journey and they have succeeded. So what can I learn from them? So support groups do exist, and we provide linkages to some of these support groups. Some of these children go on to have special education needs, so we work with educational groups and the ministry, so that they can get appropriate assessment and placement in school, so that they can achieve their optimal function. And the community, and part of the reason we do this is to create awareness that the presence of a birth defect should not compromise on the potential of an individual. They should be able to be facilitated to achieve as much as they would have achieved with or without the birth defect. KNH Prime Care is a very well-resourced center. Yes, it has capacity to diagnose, to manage, and to follow up babies who have birth defects. So we have all the personnel that's required to walk the journey with the mother right from pregnancy to delivery, and manage the baby after delivery and even in their developmental journey to make sure that they achieve optimal function. One is maintain a healthy lifestyle, both the man and the lady. A healthy eating, minimize exposure to toxins, reduction or elimination of alcohol consumption, cigarette smoking, because these are associated with increased occurrence of birth defects. 2 is have a wellness check. There are conditions that may have been undiagnosed in the mother or even in the father that they have potential of passing on to their babies, these genetic conditions. So having an antenatal visit is important because it will help to unearth some of these conditions that have the potential to be passed on to their offspring. 3 is attendance of antenatal clinics. We recommend at least 8 clinics through the course of pregnancy. So the partner support is very important here, that the mother is able to go for her clinics, she's able to take her supplements, and more importantly, we are emphasizing the role of ultrasounds in pregnancy so that we can detect as much as possible of these birth defects and we're able to guide them on how to manage them.